Mr. President, I came to the floor a few minutes after Senator Thune, the Republican leader, spoke, and I missed part of his statement, but I think I heard most of it. I listened carefully to the statement by the senator from Wyoming, and let me say at the outset that I consider them both to be friends. We disagree on many things politically, but over the years I've come to work with both of them and look forward to doing that again someday. I was disappointed in both of their statements because of what was not said. How can you talk about the government shutdown without ever mentioning health care costs to American families? How can you do that? I mean, it's a situation where we understand, I hope, that the Democrats are not in this position for any reason other than to stop the dramatic increase in health care premiums that American families will face unless we do something and do it now. State after state, the notices are going out that the cost of health insurance for working families in America is going to go up dramatically, in some cases more than 100%. And that is going to be hurtful to many. They'll have to look for different health insurance plans that they can afford, which means more money out of pocket, or they're going to drop their health insurance coverage altogether. How can the Republican leaders stand before us and even refuse to acknowledge that that is the issue that drives this government shutdown? The Republicans are insisting on their approach to the budget because they don't want to see American families protected when it comes to these health insurance increases. And the increases are already being announced. 10 states so far have announced them. October 27th is the magic date, if you will, for the announcement in my state of Illinois. I know what's going to happen. I'm going to hear from hundreds, if not thousands, of families across my state that increasing the cost for families is creating a hardship they never anticipated. We believe on the Democratic side this is the time to act now, to move together to stop these increases from taking place, because these increases were part of the big, beautiful Republican budget. The Trump budget, voted for by every Republican senator and no Democratic senators. The Trump budget, which of course he signed into law, that's what's leading to these increases, because the plans, the Affordable Care Act insurance plans, are no longer going to enjoy a subsidy, a tax credit, to help families pay the premiums, and that's why the cost is going to go up so dramatically. We can change it. We can do it, but we have to do it quickly. We ought to move on it this week. I wish the House of Representatives were in session. They haven't shown up for 2 weeks. Speaker Johnson happens to believe that being AWOL is the right thing for his Republican members. I don't think it's the right thing for America. Democrats and Republicans should be in this Capitol negotiating, sitting at a table together. And the first item on the agenda has to be health care costs for American families. All this talk about dangerous game and radical left policies and managements, it is not a radical left idea that a working family ought to have affordable health insurance. It is basic in America. As flawed as our health system is in this country, and as great as it is in many respects, if people cannot afford to have their coverage for their family, then hardship, it follows. That's the real reason. You say, well, what about the cost? Remember, this is an administration that wants to give $20 billion to Argentina. $20 billion this president's planning on giving. I'm worried more about 20 million Americans who will lose their health insurance if we don't do something and do it quickly. The American people get it. This issue has gone from the Beltway to the backyards of America. People know that this is coming, and they're worried about it, and they should be. They want us to do something, and they want it done now. And we are making the fight on this continuing resolution because it is timely, and we need bipartisan support to pass it. So let's do something positive in a bipartisan way. And dealing with the cost of health insurance is my approach that I would suggest.